Hello, my name is Anton and I'm a registered massage therapist in the province of British Columbia, Canada. I would like to start this video with a disclaimer. This video is for information purposes only. This is not a health advice and not a medical advice. Please consult your doctor before doing any of the exercises or stretches shown in this video to make sure that they're safe for you to do. Some of the major contraindications for these stretches and exercises can be any recent trauma to the spine, joints of the shoulders, neck, back, any surgeries, surgeries that involved insertion of metal parts like screws, plates, or rods into your joints or spine especially, can be a serious threat to doing any of these exercises. So again, please consult your doctor before trying any of these exercises. Also, it's very important to understand that if you have any serious health condition that affects your muscles, joints, your blood pressure, fragility of your tissues, if your tissues are fragile in general, easily getting strained, or you have weak capillaries and you bruise easily, you should also consult your doctor and try to avoid any intense pressure on your muscles or intense force while stretching your muscles, trying to do any of these exercises or stretches. If you are on any medications that affect your sensitivity, like painkillers or any other medications or blood thinners, you have to consult your doctor to make sure that it's okay for you to do these exercises while your nervous system or blood circulation or coagulation of the blood are affected by those medications. While doing stretches and other exercises, never apply excessive force because you may injure yourself. You may strain your muscles or injure your joints, and that will cause more damage than good. If you have a health condition that involves considerable inflammation, like arthritis or recent surgery or some other condition that causes inflammation in your tissues, like joint tissues and muscle tissues, you should avoid doing any of these exercises or stretches until your inflammation is gone and you are healthy enough to do them, because tissues are way more fragile during any inflammation process, and it can cause negative effect on your muscles and joints if you do these stretches or exercises while having considerable inflammation, especially in your joints, like arthritis. Doesn't matter whether it's rheumatoid arthritis or osteoarthritis. Both are relative contraindications for doing these stretches or exercises. Again, consult your doctor before trying any of these exercises or stretches to make sure that they're safe for you to do. Before we get to any of the stretches or other exercises, I have to warn you that after having those muscles or tight spots in muscles worked on, you may experience temporary aggravation of the headaches or soreness in muscles and pain in the neck and shoulders, which is normal. It's pretty much intense metabolic activities and restructuring in the tissues that you worked on, and your body will create more intense metabolic activities there that will irritate the nerves and will probably cause aggravated soreness and may even aggravate the headaches temporarily, usually up to 48 hours max. Some people experience it for a couple of hours, some people experience it for a couple of days, some people don't experience it at all. So if you have an important business to attend within the next 48 hours, or important meeting, or you just don't want to experience any aggravation of the soreness, do not do these exercises. Do them when you are ready to give your muscles and your head enough time to heal and overcome the possible aggravated soreness and headaches from between couple of hours to about couple of days. In this video, I'm gonna show you how I manage headaches, neck and shoulder pain or stiffness whenever I get them. my job is pretty physical, so quite often my neck and shoulder muscles stiffen up to the point that they start referring pain into the back of the head, top of the head, sometimes temporal area, and even forehead. It's called trigger point referral pattern. Majority of the headaches are caused by trigger points, which are spasm spots or tight spots in the muscles. And in my personal experience, in my practice, I see that majority of the patients that come to see me because of the headaches, they have those headaches because of the trigger points. Trigger points, again, it's spasmed or stiff spots in muscles, especially that have adhesions. When layers of the tissues adhere to each other, like connective tissues that surround the muscle tissues, they adhere to the muscle tissues and create those rigid muscle knots that become not just painful locally where the spot is, but also referring pain from that spot into the head and sometimes down the arm and into the back. And those points are called trigger points when they shoot pain elsewhere except being painful at the spot. If it shoots pain anywhere else, like up into the head or down into the back or into the arm and shoulder, that referral pattern is called trigger point referral pattern. In this video, I will talk about 5 major muscle groups that contribute the most to the headaches, and some additional muscle groups that rarely but can contribute to the headaches as well. And those muscle groups are upper trapezius and levator scapula. They overlap each other, sitting in the neck here and top of the shoulder. Sternocleidomastoid and scalings, and suboccipital muscles. Those are the major contributors to majority of the headaches. Also, such muscle groups as temporalis and TMJ muscles like masseter can contribute to the headaches as well. The best combination of treatments to relieve trigger points and general muscle stiffness and soreness is warming up muscle first with a local heating pad or hot shower or steam room or any other heat application. A local heat application is a little bit better because it focuses your body attention on that specific spot where you apply local heat, like a heating pad or beanbag that you put in a microwave. And warming up muscle locally will stimulate intense blood flow from the whole body into that spot where you apply heating pad, compared to general heat application to the whole body like in a steam room or in a hot bath, when blood is redistributed all over the body. So local heat application is a little bit better for the purpose of this exercise. So heat first to warm up muscles, and then gently rubbing them to stimulate circulation and to loosen it up a little bit. You can do it yourself, or using tennis balls or some other tools, or asking some of your friends or relatives to help you to rub your muscles a little bit. And then stretching. Let's start with the muscle that contributes the most to majority of the headaches. It's upper trapezius muscle. It attaches to the base of the skull, down the neck, and into the shoulder blade and top of the shoulder in here. It's pretty broad muscle. It covers pretty much a quarter of the neck there, and usually majority of the trigger points that cause the headaches are located in the lower part of it here, on top of the shoulder. And to find them, it's pretty simple. You can gently, with these 2 fingers and the thumb, gently pinch your muscle like this and gently rub it to feel where the tight and sore spots are, and compress them gently and feel if they aggravate your headache or cause the headache. When you find a spot like that, rub it gently like this. Do not press too hard, especially if you have fragile capillaries and you bruise easily, or if you're on medications that are blood thinners or any other medications that affect your capillaries, making them more fragile, because you can bruise yourself or cause serious damage to the circulation in that area. So be careful, do not press too hard, it's not necessary. Gentle rubbing will be enough to loosen up muscles and connective tissues in the area that you treat, to prepare it for stretching. After you warmed up your muscle and rubbed it a little bit to loosen it up, you prepared it to make the stretch more effective and easier to achieve better results. Now the stretch itself. To stretch upper trapezius muscle, you can use any seat that you can grab to the base of with your hand like this. Grabbing the base of the seat, it can be chair, stool, bench, anything that you can grab the base of it with, or the seat itself, with your arm on the side that you're stretching. In this case, I'm stretching my right side, so I grab the chair on the right side with my right hand. Lean away a little bit to pre-stretch, to anchor the shoulder down and pre-stretch the neck muscles a little bit to keep the shoulder anchored down so it will not be moving with your body when you're stretching your neck. Now, while holding the chair at the base here and leaning away to anchor the shoulder down, you turn your head away slightly, looking at about 45-degree angle towards the plane of the body, not completely towards the opposite shoulder, not forward, but a little bit at the angle, at about 45-degree angle towards the plane of the body. And the other hand grabs the top of your head and gently pulls in the same direction where you're looking at, like this. Again, do not apply too much force because you may strain your muscle or may cause more damage than good. Mild pressure just to feel the stretch a little bit in that area here, in that muscle and along the neck. You may feel it going down the back a little bit there, depending which part of the muscle is the tightest, but in most cases the most intense stretch is felt around this area here, sometimes up in the neck there. After you get to the stretch position, you can do a little bit of neck and head rotation just to feel which part of the muscle is the tightest, because again it's pretty broad muscle, and to find the tightest bundle of fibers you can do a little bit of neck and head rotation to find the tightest part. As soon as you sense, okay, here is the tightest part, stop and hold your stretch in that position. Again, do not force the stretch, do not pull too hard, because the more force you apply, the more muscle will engage and resist the stretch, and it's not productive, it's not effective. So gentle pressure to feel the stretch a little bit. Then, two most important things for effective stretching. First one is holding time. You should hold stretch position at least 1 minute. You can watch the clock to measure 1 minute or count to 60 in your head, but it has to be at least 60 seconds. Because that's the time required for certain neurological sensors in the muscle to react and the nervous system to react back and send signal to relax muscle. Sometimes it's pretty obvious, you can feel muscle resisting to a certain point and then it lets go and you go a little bit further without much of a pressure. After you held the stretch position for about a minute, you slowly return to neutral, doing a few neck rotations, shoulder rotations to contract and relax those muscles to stimulate blood flow in them, and then you switch to opposite side. Always stretch the opposite side even if you feel tension and pain on one side only, because symmetrical muscle groups in the body like to be balanced. So it's always a good idea to stretch a little bit the other side, symmetrical muscle group on the other side. Same principle, finding the tightest part of the muscle and holding stretch for about a minute, returning to neutral, doing a few neck rotations, shoulder rotations, and repeating stretch a few more times. Repetitions are a second important factor. It has to be 3-4 repetitions in a row to make sure that your nervous system will record new information about length, position, and level of tension in the muscle. So it will leave muscle a bit more elongated and a little bit more relaxed. So 3-4 repetitions on each side. It's easier to switch from side to side than repeat 3-4 repetitions on the same side. Then you give it a little bit of a break to the side you just stretched by switching towards the opposite side. Trigger points in upper trapezius muscle in most cases cause headaches behind the ear, in the back of the head, above the ear, may cause some pain inside the ear, temporal area, around the side of the eye here, and sometimes in the jaw. Now, second muscle group that contributes to the headaches most often is sternocleidomastoid. This muscle, here it is, it attaches to the base of the skull behind the ear here, runs diagonally across the neck and splits the head of it, splits here and inserts into the 2 points, one on the collarbone here and another one on the sternum. Those are 2 attachment points to the 2 heads of sternocleidomastoid muscle. This muscle most often refers headaches into the temporal area, above the eye, or inside the ear, above the eye, into the brow area, and sometimes into the jaw as well. Before stretching sternocleidomastoid, do not apply heat directly on the front of the neck. There are too many structures here that don't like to be overheated, like lymph nodes or major arteries and nerves, and it's not a good idea to apply direct heat on the front of the neck here. It's sufficient if you will apply heat on the back of the neck there or top of the shoulders. The circulation will increase in the area anyways. So do not apply heat directly on the front or side of the neck here. You can also gently rub the muscle or brush it with back of the hand like this, very gentle pressure, just to stimulate the circulation a little bit. Again, make sure that there is no pathologies in your neck that can be affected by this exercise and the following stretch, because you can do more damage than good. So talk to your doctor, make sure that it's safe for you to do this exercise. For sternocleidomastoid stretch, it's a little bit tricky and you have to make sure that you do it right and you do very mild pressure while doing this stretch, because if you overstretch the muscles, sternocleidomastoid and especially scalenes, muscles sitting right under the sternocleidomastoid that originate from the neck and insert into the top 2 vertebrae, you may make them inflamed, and nerves that come out from the neck and form brachial plexus that innervates your arm and shoulder, those nerves will inflame as well. If muscles will be strained and inflamed, nerves will inflame. It will be very painful, it can be very dangerous and may cause even decreased innervation of the muscles, which can lead to weakness in muscles, and recovery time may take quite long. So be very gentle and back off from stretch position if you feel any sharp pain, any burning sensation, or any pinching sensation in your neck. Do not overstretch. This is very important. In general, while doing any stretch, if you feel sharp pain or very intense pain or burning sensation or electric shock, stop that stretch immediately. That means that you're pinching some structures or pulling on joint or muscle too hard, or straining your muscle or pulling on the nerves, which is not good. So back off from stretch position if you feel sharp pain, burning sensation, or very intense pain, or any pinching sensation, especially if you are stretching your neck, because that can be dangerous. Start very light pressure and gently, slowly bring your joint into the stretch position or muscle into the stretch position, slowly increasing the pressure. And again, it's not necessary to pull too hard to stretch muscle more. It's usually the opposite. The harder you pull in the muscle, the less effective the stretch will be, because naturally nervous system will engage the muscle to prevent strain and muscle will be resisting the stretch. So it is not productive if you pull too hard on the muscle. Mild pressure gives better stretch effect than hard pressure. For sternocleidomastoid stretch, original position is also sitting on a chair or bench, where you can grab the seat with your hand on the side you're stretching. In this case, I'm stretching my right side and I'm holding the base of the sit with my right hand to anchor the shoulder down. I lean away a little bit to anchor the shoulder down. In this case, I turn the head over this shoulder, trying to bring two spots where sternocleidomastoid muscle attaches, collarbone and sternum here, and base of the skull behind the ear there. I'm trying to bring these two spots as far away from each other as possible. But with this one, again, be extra careful. Do not overstretch it. And if you feel any pinching sensation in the neck, any burning sensation, any sharp electric pain, back off from the stretch position immediately, because you can do more damage than good. Okay? Holding the base of the seat with your hand, leaning away to anchor the shoulder down, looking above and behind you over the same shoulder, and the other hand grabs your head above the eye here and gently pulls back. Just very light, gentle pressure. You're supposed to feel gentle stretch along this line. You may not feel it much, but if you're in the right position, like this, you will stretch those muscles anyway. Again, two most important things for effective stretching: holding time, at least 1 minute holding stretch position, and repetitions. You have to repeat each stretch 3-4 times in a row to make it more effective. And again, it's usually a good idea to switch from side to side. 1 minute hold, returning to neutral, stretching the opposite side. 1 minute hold, returning to neutral, stretching the other side. Repeating 3-4 times on each side. Now, suboccipital muscles. It's a small group of muscles at the base of the skull, right there. And they are the ones that attach base of your skull to the top two vertebrae of the cervical spine. They're the ones that extend your head on top of the neck, roll it on top of the neck like this. So to prepare those muscles for stretching, you can again apply a little bit of heat on the back of your neck and head there to warm it up a little bit. 3-5 minutes warming up. Then rubbing them gently with your fingertips like this, or with fingertips like this. I find this way a little bit easier to do because you can reach a little bit better with your thumbs under the skull there and find those tight spots in those muscles. Rubbing it gently. Do not push too hard. And then the stretch itself. With this stretch, you will be trying to roll your head on top of the neck without much of a neck flexion, like this. And for this stretch, you tuck the chin in with one hand, with web of the hand. You push the lower jaw slightly towards the neck and a little bit up, like a scooping motion. And the other hand grabs the top of the head and gently rolls it forward, like this. With this one, you have to be also very careful. Do not push too hard. Do not pull top of the head too much forward. Very gentle pressure. Those muscles are tiny, they're this big, and they don't need much force to stretch. You may not feel the stretch very intense because again those muscles are very small, but as long as you feel a little bit of stretching at the base of your skull, you're doing it right. And again, the same principle, you have to hold this stretch position 1 minute and repeat it 3-4 times in a row, like this. Holding for 1 minute, returning to neutral, rubbing there with your thumbs or fingertips like this, repeating again, holding 1 minute, again rubbing, repeating the stretch. Suboccipital muscles can cause headaches around the ear, in the temporal area, and forehead. Those are the most common referral patterns. I saw some cases when those muscles were referring to some other areas of the head, but those are rare. Now let's talk about some additional small muscle groups that can contribute to the headaches and general stiffness in the face and head. First of all, it's temporalis muscle that sits on the side of the head here, on the temple, and pretty much covers the whole area above the ear here. And this one inserts into the lower jaw. This is one of the muscles that contributes to chewing. To find those tight spots or spots that cause the headaches in this muscle, you can gently with your fingertips rub your temples and see if you feel any tight spots or sore spots that aggravate the same headaches that you usually feel or causing headaches. If you find any of those spots that cause the headache, you can focus on those spots a little bit more, gently rubbing them with fingertips. Again, you don't need to apply too much pressure. Gentle pressure is enough because that muscle is relatively flat and small, and it doesn't require much pressure to release those tight spots. Gently rubbing with fingertips. Then you can give it a break for a minute, then rub it again. To stretch that muscle, you can gently press on it right in the temple area here and open your jaw. This is called pin and stretch. Pinning the muscle and then stretching it. Now, masseter muscle. It's a muscle that the main chewing muscle touches to the cheek there and inserts into the lower jaw there. Kind of a square muscle in here. To find it, it's really simple. You just hold your fingertips there and clench your jaws. And that muscle will bulge right under your fingertips. You will feel it right away. You can also rub it gently with your fingertips, trying to find sore spots or tight spots. And this muscle usually causes headaches in the face area here, in the jaw, in the cheeks there, or sometimes in the temple area here closer to the ear. You can rub it a little bit. And then to stretch it, again, you just compress that muscle right there and open your jaw. You can repeat this pinning and stretching 10-15 times in a row. Then let it rest for a couple of minutes, then repeat the exercise again. This exercise also helps to relieve tension from TMJ, temporomandibular joint here. Quite a lot of people have tension in the TMJ that causes clicking of the jaw when you open it, and sometimes pain inside the joint itself. So this stretch and rubbing this muscle helps to relieve tension from TMJ as well. There are also a couple of flat muscles on the skull that can also contribute to the headaches. One in the front here called frontalis. Another one is in the back of the head called occipitalis. Both are relatively flat muscles, and the only thing they do, they tighten up your skin on the skull a little bit. Working on frontalis and occipitalis is pretty simple. You can just rub them with fingertips like this in circular movements. If you find some spots that are specifically tender or causing pain that is similar to the headaches that you've been experiencing, focus on those spots a little bit more, because those are probably the ones that cause the headache or pain in there. For occipitalis, you rub it like this with fingertips. The best time to do it is before going into sleep, before bedtime, or even right when you're in bed already, trying to fall asleep. This is a very relaxing massage procedure. You can just rub your skull pretty much everywhere, temporal area, forehead, top of the head, back of the head, and around the ears. This is very relaxing and helps you to calm down your nervous system and also to fall asleep much better and faster. and will relax some muscles on the skull that may contribute to the headache and general sensation of tension in the head. Some muscles in the back of the neck can also contribute to the headaches and into general stiffness and soreness in the neck and shoulders, like splenius cavities. And to stretch them all with one stretch, you can do the following. First of all, you have to again apply a little bit of heat there to warm up those muscles, to warm them up, to loosen them up with heat a little bit. Then you can gently rub them with your fingertips like this. Gentle pressure. Don't press too hard. If you feel any considerable pain on your fingertips, lighten the pressure. Do not press too hard. And then to stretch them all with one stretch, pretty simple. You bring the chin down towards the notch between collarbones, lock your hands like that, rest your locked hands on top of the head, pull your head down, and bring your elbows together as close as possible. By bringing the elbows together, you wing the shoulder blades out a little bit and stretch levator scapula and upper trapezius as well a little bit, because they attach to the top of the shoulder blade there. At the same time, you're stretching rhomboids and some other muscles. Holding this position for about a minute, slowly returning to neutral, doing a few neck rotations like this. You can rotate your shoulders as well to stimulate blood flow in those muscles. Repeat and stretch again. Holding a minute, returning to neutral, rotating your neck. Repeating a few more times, 3-4 repetitions in a row. To loosen up tight muscles of upper back and shoulders and neck as well, I use tennis balls with yoga mat on carpet or on carpeted floor. If you don't have a yoga mat, you can just do it on a carpeted floor. It's much more difficult to do it on a hardwood floor because it will be too hard for you to lie on. So you have to put either some carpet or mats or something softer, but not too soft, to not allow the balls to sink into the thing that you put on the floor. Okay. Except tennis balls, I sometimes use a therapeutic ball, which is way harder than tennis balls, and it's a little bit more specific for tight muscles or tight spots in the muscles along the spine. With harder objects like this therapeutic ball, you have to be careful not rolling over the bony parts because you may bruise yourself. Tennis balls are much softer, so it's much less chance that you can bruise yourself using tennis balls, and they work really well along the whole back. And the way how I loosen up shoulder and upper back muscles, I put the balls on the floor next to each other on both sides of the spine. You can put them closer together if you want to rub muscles right next to the spine, or a little bit apart to rub muscles closer to the edges of the shoulder blades or on the sides of the spine there. The wider you bring the balls, the more you cover muscles on the side here. The closer you bring it to the spine, the more you cover muscles along the spine itself and the spinal groove there. Putting balls in there. Putting balls under my shoulders there. I usually bring my arms across my body like this, like giving myself a hug, to wing the shoulder blades out, to pre-stretch the muscles, and bring the shoulder blades out of the way of the tennis balls to kind of expose muscles a little bit better. Then I bend my legs, and using my legs I lift my pelvis off the floor. That will bring more body weight onto the balls and will increase pressure a little bit. If it's too hard for you or too painful, bring your pelvis back on the floor and just using your legs roll a little bit up and down on those tennis balls or you can roll a little bit sideways, finding those sore spots or tight spots in your muscles and rubbing them. Then you can bring them a little bit lower and rub the muscles between shoulder blades. It works really well to loosen up tight muscles in between shoulder blades and along the spine. If you have any metal inserts into your spine, like metal rods, metal plates or screws, or you had recent injuries or some kind of arthritis or some other conditions in your spine or right next to the spine, be very careful. Do not do this exercise until you talk to your doctor and make sure that it is safe for you to do. To work with tennis balls on your neck, hold them like this, put them under your neck there, and just gently rub, rolling a little bit up and down on the balls. Very, very light pressure with this one. This is how I hold them there. I'm just moving slightly up and down. With therapeutic ball, you can work one side at a time, even some muscles on the shoulder blade, like rotator cuff muscles. Bringing the ball towards the side that bothers you, where the tight spot is. You can hold it there with one hand and roll on it like this. Or put it closer to the spine and tilt your body a little bit towards the side and roll on it. But again, be careful, do not roll over the bony parts, bony protruding parts, because that may bruise your muscles if you push too hard with hard ball like this over the bony parts, especially shoulder blade. But this one is a little bit more specific and better to target some stiff spots and muscles in between shoulder blades or in the shoulder like this. I'm holding it like this there and bringing my body weight on it and rolling on it. I can elevate my pelvis a little bit to bring more body weight on the ball, and then it presses a little bit harder. In the conclusion, I would like to mention a few things. First of all, after doing these exercises and stretches, you may experience a little bit of soreness in those muscles and a little bit of aggravation of the headaches for probably up to 48 hours. And that's one of the side effects of these treatments, and it's normal to experience that. Most people, after having those tight spots and tight muscles worked on and stretched, they experience a little bit of aggravation of the symptoms, because you irritate by rubbing and stretching the tight or sore spot in the muscle. You irritate the nerves, you irritate the muscle and intensify the metabolic activities in that spot, and your body starts doing more intense metabolic activities there, restructuring the tissues and healing them much faster. But that comes with a little bit of soreness and may temporarily aggravate the headaches. After these exercises, it's quite important to drink as much water as possible and to avoid any strenuous activities for those muscles that you worked on. You have to give your muscles at least 48 hours rest after these exercises to not trigger any adverse reactions like muscle spasming or twitching, because after rubbing those tight spots or trigger points especially and stretching your muscles, they will need some time to rest and recover after it, and for some restructuring processes to undergo in the muscle tissues. And you have to give your muscle a break. Do not overload it with physical activities right after you did this work with rubbing trigger points or stretching your muscle. Give it some rest. After any stretch or working on your muscles with tennis balls or any other direct work on the muscle, like rubbing it, like massaging it, you have to drink as much water as possible unless you have some kidney issues. Again, check with your doctor if drinking more fluids is okay for you. And more fluids are important to allow your body more fluids to circulate the nutrients and to flush metabolic waste out, because muscles that you worked on will be undergoing very intense metabolic activities and restructuring, and you need to provide enough fluids for your body to provide enough blood flow and lymphatic fluids flow into that area to flush metabolic waste out and to bring fresh nutrients and oxygen to feed the muscle properly to speed up recovery. So drink as much water as possible. Coffee is not a good fluid in this case, because coffee leads to the opposite. It has diuretic effect. It flushes fluids out of your body. So coffee would not be a good option in this case. You have to drink more water or tea. After any kind of work on the muscle, like rubbing it, massaging it, stretching it, you have to avoid, for at least few hours, avoid over chilling that muscle, because when muscle getting worked on, even with stretch, it stimulates circulation in that muscle, and circulation warms it up. If you over chill it suddenly, stepping out in the cold weather or like direct cold draft blowing on that area, that may over chill the muscle to the point that it will inflame and will cause muscle spasming, twitching, and quite considerable soreness. To avoid that, keep your muscles warm and covered for at least a few hours after any kind of exercise or stretching. And also do not sleep anywhere close to open window when the cold draft could be possibly blowing on your neck and head, because that may also lead to some inflammation in the muscle, especially after it's being worked on. If you have any questions, leave me a comment below this video, and if you like this video, subscribe to not miss the future videos that I'm gonna release soon, and give me some thumbs.